Welcome to the Community Meets Clinic series, a collaborative podcast to introduce clinicians, clinician scientists, and healthcare personnel working directly with individuals and families facing a rare neuroimmune diagnosis. Hear directly from those in the clinic and connect with the individuals whose focus is promoting quality of life for those diagnosed with a rare neuroimmune disorder. SRNA is a nonprofit focused on support, education, and research of rare neuroimmune disorders. You can learn more about us on our website at wearesrna.org. Community Meets Clinic is sponsored in part by Amgen, Alexion AstraZeneca Rare Disease, and Genentech. My name is Krissy Dilger, and I moderated this episode. Today we meet Dr. Monica Diaz, a clinician from University of North Carolina Health. Dr. Diaz is an assistant professor of multiple sclerosis and neuroimmunology at the UNC School of Medicine. You can view her full bio in the podcast description. Welcome and thank you so much for joining me today, Dr. Diaz. I'm excited to speak with you and to learn a bit more about you as well as the clinic at University of North Carolina, Chapel Hill. So to start, can you tell me a little bit about yourself and what led you to neurology and in particular neuroimmunology?
Sure. So first of all, thank you for inviting me to be on the podcast. So my name is Monica Diaz. I'm a neurologist and neuroimmunologist at University of North Carolina at Chapel Hill. And I've always been interested in the brain ever since I was young. I was always really interested in how mysterious the brain is and how it can really affect how we function, how we think, how we act. And then that also, so that's what initially led me to go into neurology, was just I was like really fascinated by how it is that, one small change in the brain can really have such an impact on people's lives. And then I decided to go into neuroimmunology specifically because I was always really interested in solving problems. So, a lot of neuroimmunologic conditions, sometimes we don't find an answer and we don't find a reason why it happened. But, I like kind of those maybe more uncommon neuroimmunologic disorders that really take more thinking and thinking outside the box. And there's a lot of thinking outside the box that happens in neuroimmunology. So all of that kind of made me go into neuroimmunology, and I think it's a changing field. There are so many more treatments that are effective for many neuroimmunologic conditions that weren't available years ago, and it's definitely a changing field. So that's what makes it an exciting field to work in.
Great. And you kind of already touched on this, but a bit, but what led you to be interested in particular in the rare neuroimmune disorders? So some of this disorders that we advocate for at SRNA, such as transverse myelitis, neuromyelitis optica spectrum disorder, MAG antibody disease, and so forth. And then do you have any particular interest areas that you are working on in research?
Mhm. Yeah, so those are great questions. So like I mentioned, I became interested in rare neuroimmunologic disorders because, I think it does take a lot of problem-solving skills sometimes to figure out what the diagnosis is because, as you mentioned, I mean, these are rare conditions that oftentimes we don't even learn about in medical school. So it does take a lot of thinking. And then I also really like the multidisciplinary approach. Sometimes we have to work with our, ophthalmologists and urologists and rheumatologists to kind of manage and treat patients well. So, and then as far as research, I do have a lot of research interests, but right now my research focuses on demyelinating disorders in Latin America and also in ethnic minority populations in the United States. So I have one research study where we're looking at the various etiologies or the various causes of transverse myelitis that occurs in Peru. A lot of my research is actually in Peru. I've been working there since 2019 and on different projects, but I do have one study going on right now that is enrolling patients that are admitted with a diagnosis of transverse myelitis to a big neurologic hospital down in Lima in Peru. What we're interested in is looking at characterizing the different causes. So whether it's more infectious or autoimmune causes or other causes of transverse myelitis. And we're hoping to be able to get more participants and also analyze the spinal fluid. And there's a lot of information that we can gain from that spinal fluid, including whether it's an infectious cause, an autoimmune cause, or another cause. So I'm looking at that. And then also very interested in how these conditions of both transverse myelitis, neuromyelitis optica spectrum disorder, and MOGAD present in the Latino community in the United States. So right now we're working on a study at UNC Chapel Hill looking at how outcomes present in this particular ethnic population. And then also looking at, for example, like healthcare access, healthcare literacy, distance from the patient's home to our facility, and how that impacts clinical outcomes, so relapses, disability, and MRI activity.
Wow, that's all very exciting and important work. I know we at SRNA are lucky to work with such amazing researchers and clinicians such as yourself. And so I think there's a lot to learn and thank you for doing this work. It brings a lot of hope to the community. So can you share more about your specific neuroimmunology clinic team at UNC? What other specialists might a new patient expect to see if they, make an appointment with you? How does a new patient typically get connected with your clinic, and what might that look like?
Yeah. So thank you for bringing up the clinic that we have. So at UNC Chapel Hill, we have the Bodford Family Transverse Myelitis Center, which is located in Hillsborough, North Carolina. It's just a short 15-minute drive from Chapel Hill, so right by the Triangle area in North Carolina. And it truly is a multidisciplinary team because we have a wide array of specialists that we work with. So not only is it a neurologist that you will see, but patients oftentimes will also be referred to our physical medicine and rehabilitation doctor that works with us in our clinic, particularly people that might be using a wheelchair or might need Botox injections for spasticity in their arms or their legs. We tend to work really closely with our physical medicine and rehabilitation or PM&R doctor. We also collaborate with a urologist if patients have difficulty with bladder symptoms, a neuro-ophthalmologist if they have difficulty with their vision. And then we also have nurses that are trained in demyelinating disorders or in rare neuroimmune disorders that work in our clinic, and a social worker and mental health therapist. And we also have a pharmacist as well, who's key in really making sure that patients get started on their treatments very quickly. So we kind of truly are a multidisciplinary team and very collaborative in that, that's the nice thing about having all of these specialists all under one roof, is that we can all talk to each other very easily. So not all patients need to see all of these specialists. It just depends on what's going on in their particular situation, but these are like the specialists that are available. And the other question was, how does a new patient typically get connected with you? So the referral process, usually it could be either a referral from a primary care doctor in the community, or I would say more often than not, it's a neurologist in the community. Our catchment area is very large. We see patients from all over North Carolina because we're the only transverse myelitis center in North Carolina. We have patients that come from Virginia, from Tennessee, from South Carolina. So we get all of these referrals from the area. And yeah, it's really nice to be able to see patients coming from all over. So it's good.
Great. Sounds like a very multidisciplinary approach, which is always amazing, especially for patients to
Yeah.
have that kind of like a united front to kind of handle all the things that can unfortunately come with being diagnosed with one of these disorders. So yeah, that sounds awesome. And we will link to your website in the description. So if anyone's interested
Great.
in making an appointment, you can find that, or you can search for Monica Diaz. And she is also in our medical professional network on our website. So that's great.
Great.
So
Thank you.
just kind of as more personal question, I suppose, as a clinician, I know it can be kind of heavy and there can be a lot of emotions when dealing with some of the incredibly difficult things that come with these disorders. So how do you take care of yourself outside of, the clinic? How do you stay grounded? How do you re-energize after one of those tough days or weeks? And yeah, how do you spend, I guess, your free time to do so?
Yeah, no, this is maybe the most important question. No, so I think it's important to, you know, realize someone's limit, I guess, and just, being self-aware in that you can't do it all. And, I think it's especially important to take time to not just work all the time, but take personal time and be with family, which is very important to me, of course. And then also just doing things that are enjoyable outside of the clinic and outside of work time, right? So I have the fortune to live in North Carolina where we have a lot of great hiking trails, and I love the outdoors. So my family and I will often do, a lot of hikes around North Carolina, and a lot of traveling too. It's nice to go on road trips too, which is nice. So I mean, those are some of the things that I enjoy doing outside of work, and I think I especially love the outdoors because you can really take time to kind of think about things and process things if needed. Um, so that's kind of my method, I would say. But yeah, so I don't know if that answers your
Yes.
question.
Yeah, that's great. I I think I'm a little jealous of the weather in North Carolina, having been living further north. No, that's great.
Yeah.
So, is there anything you'd like to share for people, someone diagnosed with a rare neuroimmune disorder who is considering your clinic for care? Anything you want them to know?
Yeah. So I will say I didn't mention this earlier, but I know the title of the clinic is a transverse myelitis center, but we see any patient with any spinal cord disorder. So that could be, somebody with multiple sclerosis that's affected the spinal cord, transverse myelitis, neuromyelitis optica, any or an infectious cause. These are the major reasons why or spinal cord stroke. Those are the major reasons why we see patients in our clinic. So I think, so anybody that might be considering receiving care in our clinic could ask their doctor, their primary care doctor, or their neurologist for a referral to our center, and we're happy to see them. And then I think, it's important to also just remember that it is, sometimes it can be a long recovery process. And, one of the key things is really staying active, right? So working with physical therapy, just making sure that you stay as active as possible to help with the recovery process after having had transverse myelitis. And then working with the multidisciplinary care team, whether that's the physical medicine doctor, the urologist, or any of those other specialists that I mentioned earlier. And I think that really helps go a long way in when recovering or when trying to maintain a certain level of physical activity and independence, right? So
Great. And my last question is just something I like to sometimes end my conversations with because I think it's important to stay hopeful. So, what are you hopeful for in the future of rare neuroimmune disorders?
yeah. So like I mentioned at the beginning, I think it's a really exciting field because there are so many treatments coming down the pipeline and very effective treatments that weren't available even 5 years ago. So I'm very hopeful that in the future, one, we'll be able to find a cure for these rare neuroimmune disorders, but also, if before we find a cure, if we can't find it that quickly, that we have more effective treatments with less side effects for our patients that will hopefully help reduce disability progression and relapses and those kinds of things that we monitor as clinicians.
Well, great. Thank you so much for joining me. That's the end of my questions. Hope to speak with you again, hopefully in another podcast in the future or at one of our events. And it was lovely getting to know you and hear more from you.
Great. Thank you so much for inviting me.
Thank you to our Community Meets Clinic sponsors, Amgen, Alexion AstraZeneca Rare Disease, and Genentech. Amgen is focused on the discovery, development, and commercialization of medicines that address critical needs for people impacted by rare, autoimmune, and severe inflammatory diseases. They apply scientific expertise and courage to bring clinically meaningful therapies to patients. Amgen believes science and compassion must work together to transform lives. Alexion AstraZeneca Rare Disease is a global biopharmaceutical company focused on serving patients with severe and rare disorders through the innovation, development, and commercialization of life-transforming therapeutic products. Their goal is to deliver medical breakthroughs where none currently exist, and they are committed to ensuring that patient perspective and community engagement are always at the forefront of their work. Founded more than 40 years ago, Genentech is a leading biotechnology company that discovers, develops, manufactures, and commercializes medicines to treat patients with serious and life-threatening medical conditions. The company, a member of the Roche Group, has headquarters in South San Francisco, California. For additional information about the company, please visit www.gene.com.